You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people with leg veins or veins on their hands, face, or any unsightly veins, especially painful veins. With us, we have an expert on the topic, board-certified vascular surgeon, Dr. Kingsley. Dr. Kingsley, welcome to the program.
Thank you very much.
Always a pleasure to have you on the show.
Thank you.
Now, I interviewed you about a year ago
Yes.
on veins. What's changed, by the way, in that year?
Biggest change has been the evolution of the specialty of phlebology.
Okay.
Phlebology is now its own specialty in the medical field.
Okay, now for people that don't know you, I mean, you have one of the busiest practices in the world.
Correct.
Some people even say that the busiest in the world. Alabama and Atlanta Vascular Vein Center. Okay,
Right.
Tell me about it. What type of patients do you see?
Well, we see patients now from all over the South. We see a fourth of our patients are men. Most of them have symptoms. Symptoms meaning leg pain is the most common symptom. Leg swelling is probably the most second common symptom. And then we have, of course, a broad spectrum from the severe to the not so severe. The patient with vein stasis ulcers, very painful wounds, sores on their ankles. And then we have the mostly younger gals, although some older gals who have the unsightly spider veins, and they don't like the appearance. A lot of spider veins are uncomfortable, and they want those eliminated so that they can move on in life.
Now, we should mention that you teach medical doctors
Right.
internationally
I do.
about veins.
I do. I have a number of doctors who come to our centers from around the country, United States.
Even Japan.
I
Is
go
that
to,
right?
yeah, the Japanese come and train with us, and I go once a year to the Tokyo Vein Clinic, and I teach the doctors. I go to Australia each year and usually give talks to the Australasian College of Phlebology. In fact, they made me an emeritus fellow 2 or 3 years ago, so I march in their ceremonies with cap and gown. And
Is there that much to it, though? Is there that much to it that the doctors, I mean, is there a big learning curve? I mean, nowadays, does the technology do all the work?
The main technology is ultrasound, but what I think patients should understand is that phlebology, vein disorders seem, not only to patients but to doctors, they seem simple, and in fact of the matter, it's not so simple. And real good, proper treatment requires a fair amount of expertise, just as in any other specialty.
So you don't do stripping anymore? By the
No
way, in the
stripping. I
hospital?
haven't done a stripping operation in 10 years.
What if I talk to somebody and they say, well, the problem is if you don't strip them, they're just going to come back? Is that not true?
Well, the stripping failure rate was about 20%.
Is that right? Okay.
That's true. And now we have discovered there are not only saphenous vein incompetence, but there may be an anti-accessory saphenous, a post-accessory, a perforator vein. And we map all that out on ultrasound, and during the surgery, at least that we do, we treat each of those abnormalities at the same time. So the recurrence rates we see are they're minimal, much reduced from many years ago.
Okay, are there people, by the way, I mean, would you say thousands in Atlanta, Alabama, you know, the places you serve, that have varicose veins, painful veins, and they do nothing? And why aren't they doing anything if this is...
Well, there's several reasons. One is the misconception that a lot of vein treatments are pure cosmetic and not insurance covered. That's one thing.
Oh, really? Okay,
Yes,
so insurance covers this.
The insurance covers all of the major vein treatments we do.
Interesting.
And most vein disorders have a true pathophysiologic basis for their problem. And as time goes, they get worse and worse and worse. That's the evolution of vein problems. And patients don't understand that. Men tend to ignore even pretty severe vein disorders. They're not terribly painful. They don't interrupt with what they do too much. What they do tell me once treated is, my gosh, my leg feels so much better. I wish I had done this years
So
ago.
where is somebody headed? That's an interesting point. Okay, so somebody has varicose veins, but they say, I don't care about the appearance. Where are they headed? And what's going on there?
Well, it depends on the severity of their incompetence. They have, all of these veins have one-way valves, and if all of the valves are incompetent, they will be headed towards leg swelling, pretty severe, discoloration of their legs. The legs, because serum and blood leaks into the tissues, the iron pigment turns the skin brown, often black, and it's permanent, it's like a tattoo. And then they'll break the skin down around the ankle ultimately, and they'll have these vein stasis ulcers that are
So
very
the fact
painful.
that you have a vein that's popped to the surface means you have a circulation problem? Is that an easy way to say?
Probably
Really?
have, probably have a vein abnormality that should be addressed.
Now you get the complex cases. You say that other vein doctors send you the tough cases.
I do.
Elaborate on that.
I do. Well, I began to treat vein problems at least 10 years ago, and I helped invent some of the modern treatments that we do. And now, at least across the Southeast, my center is recognized as where they can send patients of any type, whether it's a severe problem or previously treated problem, and we're able to map out the disorder, determine the best treatment, and then we treat them right in my vein center.
Now, as a trainer, a guy that teaches internationally, other doctors, you know, when you see vein places popping up all over the place, or maybe not all over the place, but a lot of them, and with all things being equal, people always email me and they say they always want a referral, and I say, you know, I'm not endorsing the doctors to come on my show, but here's my answer to everything: go to a specialist.
Yeah.
And since it's the same price, you might as well go to a vascular surgeon that does veins.
Yeah, I agree
Leg
with
veins.
that. I'm not opposed to other specialties doing vein disorders, but I am opposed to the doctor who does it just minimally or studies it minimally. I really think, as you and I would like to be treated, we want to get the very best treatment from the very best doctor, and I think that's where you should go have
You
your
like
surgery.
this, by the way. Why do you like it so much?
Well, I learned quickly this is about quality of life, not about life and death, and it's a much nicer way of life, for one thing.
You do hundreds of these a month, is that right? Or 100 or more a month?
I do probably a little more than 100 patients a month. Just the surgery,
get-
I see a lot more patients than that.
Is that, and I hear that you actually walk everybody to their car after the treatment.
I do that.
Is that right?
I do that. I have that's a unique thing for our practice. Every time I do a surgery, we do conscious sedation so that our patients have no pain during the procedure. But they're a little sleepy when they go home, and so we take them out of the vein center in a wheelchair to their car.
You do that. You wheel them
I
out.
take them each one. I don't miss a one.
Did they ever mention that to you?
I
after?
always mention it. They'll come back and say, "Doctor, I don't know what you did to me, but I never had a doctor take me to the car before."
That's very nice. Nice little touch.
It is, and I like it because I get to talk to the family while I go to the car. I get to be sure they're safe to go home. I get to tuck them in the front seat and make sure that everything is as it should be. They have all their instructions. They have their prescriptions. Their leg is wrapped properly, and I know they're going to be safe. They may drive 2 hours, or their family take them 2 hours back home, and I'm more comfortable knowing that they're safe to go home.
Now, you know, another medical doctor that I talked to about you says that that the way you do it, and I'm paraphrasing, very little pain.
Right.
So there's technique with that. Because it sounds like a painful thing.
Yeah,
getting,
I agree with
injected.
that. I think there's no reason to have pain in modern medicine, you know, and a lot of physicians do this. In fact, they will advertise you can come in at lunch and have this procedure done, and we'll numb up your leg, and then you can go back and walk back to work. And
What are your thoughts on that?
No question that can be done, but if it were me, I don't want it done that way. There's enough pain involved. There are a lot of needle sticks. And my patients, at least 99%, say, knock me out, don't let me suffer. And so that's what we do. So we give them sedation.
So if you do it right the first time, they don't come back. I mean, that's the goal.
Well, that's the other point, is that I don't do one procedure and then say, come back in 2 weeks and I'll do another, and 2 weeks later I'll do another.
That's common practice,
That's
by the
a
way?
common practice. So we do everything that needs done in one setting.
Is that safe?
Oh, very safe.
Okay.
Yeah, and it gives them the best result in the least amount of time. In a short time, their leg is restored to normal. I mean, the pain's gone, swelling's gone, ulcers heal quickly. We treat the spider veins while they're sleepy. Patients love that because there's a lot of needle injections.
So you do the little veins, too?
Yes, a lot of them.
And what are the average age of your patients?
Well, most common are ladies 30 to 60. Most common.
What about the oldest patients?
93.
Is that right?
Yeah, and I've done several of the 90-year-olds.
So it's not a cosmetic. I mean, their legs are in pain?
This
Is that what's
lady
going
had
on?
one of these stasis ulcers, and she said, I said, ma'am, I'm a little worried about your age. And she said, I just give me 6 months without pain.
Really?
Okay, I'll do that. So I fixed her leg, and I think she's 98 now. I've fixed her other leg since then. So age,
So like a diabetic-looking ulcer,
Well,
can be taken care of? I'm calling it diabetic
Sure.
ulcer, but these ulcers can be taken care of with
Yeah,
the treatments
the
you
most
do.
common ulcer in all the wound centers of the world is a vein stasis ulcer caused just from what we treat patients with every day.